I am Dr. Prasant Parida. I am a medical oncologist at HCG Pandya Cancer Hospital and AHRCC Cuttack. Breast cancer is one of the commonest malignancies in our country, and almost every year 1,75,000 new breast cancer cases diagnosed in our country, and it is almost 1/4 of all the malignancies found in females. So this breast tissue is made up of glandular tissue and ductal tissue. This glandular tissue, which are called lobules, they secrete milk, and this ductal tissue, these are just like tubules. They carry these milks to the nipples from the lobules. In addition to these tissues, this breast also contains connective tissue, fats, lymphatics, and blood vessels. And most of the bulk of the breast tissue is made up of this due to this fat tissue. Among the cancers, ductal carcinoma and lobular carcinoma are the two commonest type of breast cancers. Ductal carcinoma is more common, and it originates in the ductal epithelium, whereas lobular carcinoma in the lobules. When these carcinomas, they does not invade beyond the basement membrane, and they localized, these are called ductal carcinoma or lobular carcinoma in situ. Whereas when these carcinomas invade beyond the basement membrane, invading other tissue, these are called invasive breast carcinoma or invasive carcinomas. Among these types, there is a typical type of breast cancer called inflammatory breast cancer, where the breast looks like red, tense, and tender. This is due to involvement of dermal or lymphatics in the skin, and it is one of the malignant, means very poor carcinomas of breast. And this breast cancer, though it is commonly seen in women, it can be seen in males. Almost 1% of all breast carcinoma are found in males. Now coming to the causes of breast cancer. Among the common causes, estrogen excess. This estrogen is a female hormone, and the duration of estrogen exposure or estrogen excess is directly correlated with increased risk of breast cancer. So among these factors, early menarche, late menopause, nulliparity or childlessness, and late marriage, late childbirth, avoiding breastfeeding, obesity, alcohol, as well as birth control pill or oral contraceptive pills. So these are the causes which is associated with estrogen excess or increased duration of estrogen exposure, so increasing risk of breast cancer. Then other factors like excess fat and obesity, physical inactivity or sedentary life habits. And one of the cause, almost 5 to 10% of breast cancer patients have family history. This family history or hereditary breast cancer is found in 5 to 10% of cases, and it has been seen that it has been associated with some of the genes like BRCA1, BRCA2, P10 or other genes which can give rise to, along with breast cancer, other cancer like ovarian cancer, endometrial cancer. So these are called hereditary breast cancer or familial breast cancer. So these are the causes of breast cancer. Among the causes of breast cancer, estrogen excess. This estrogen is a female hormone. So estrogen excess or increased duration of estrogen exposure is directly related with increased risk of breast cancer. And some of the factors of estrogen excess are early menarche, late menopause, late marriage, late childbirth, then avoiding breastfeeding, or nulliparous or childlessness, which is called as nulliparity. So these are the excess estrogen states which is associated with increased risk of breast cancer. Among other the factors like lifestyle factors, sedentary life habit or obesity, which has been associated with increased peripheral conversion to estrogen in fat tissues, and dietary factors excess fatty foods is also associated with increased risk of breast cancer. Then alcohol, excess alcohol intake, and sometimes oral control pills or birth control pills is associated with increased risk of breast cancer. And one of the important causes is family history. About 5 to 10% of breast cancer cases has been associated with some of the family members affected with breast cancer. This is called familial breast cancer or hereditary breast cancer. This hereditary breast cancer is associated with some of the genes like BRCA1, BRCA2, check gene P10. So these are the genes which increases the risk of breast cancer in these patients, and these are called the hereditary breast cancer or hereditary breast ovarian cancer syndromes. So in these hereditary or familial breast cancer patients, along with breast cancer, some other malignancies can be seen like ovarian, endometrial or prostate cancer in males can be seen. The treatment modalities used in breast cancer are surgery, chemotherapy, radiotherapy as well as hormonal therapy. Surgery is the definitive therapy in especially early stage breast cancers, where we usually remove completely the breast tissue as well as axillary lymph node dissection. This is called as MRM, modified radical mastectomy. But nowadays, the lumpectomy or breast conservation surgery, you can keep your breast tissue with only by removing the malignant or cancer tissue. This is called breast conservation therapy, and the survival with breast conservation therapy or breast conservation surgery is almost equivalent with complete removal or modified radical mastectomy. But one thing, in BCS or breast conservation therapy, radiation is mandatory, whereas in modified radical mastectomy, radiation is required based upon the nodal as well as tumor size. For radiotherapy, it depends upon the size of the tumor. If the tumor size is more than 5 cm or node positive, axillary node positive, or there is margin positive, or if patient has undergone breast conservation therapy, then radiation should be given after completion of surgery. So this radiation technique vary because previously only external beam radiotherapy was used, and the standard duration was 25 fraction, 5 days a week for almost 5 weeks. But nowadays several modification has been seen, especially like APBI in early stage breast cancer. Those having less than 2 cm, node negative, good prognostic factor. In that case, accelerated partial breast irradiation can be used, only 10 fraction we can give. And internal radiation, these are external radiation. Sometimes we keep a implant during surgery in the breast tissue. This is called internal radiation or brachytherapy, and we keep a mammocyte during the surgery, and radiation was given in the mammocyte cord to the breast tissue. So these are the types of radiation in the breast. And for chemotherapy is one of the adjuvant therapy in breast cancer, and it is the systemic therapy. Chemotherapy is the medicine we use to kill the cancer cell or to destroy the cancer cell. So these chemotherapeutic agents, they usually affect the whole body going through the bloodstream. Chemotherapy we use in early stage breast cancer to kill the residual at the local site and to take care of the micrometastasis in the blood. And in the advanced stage, this chemotherapy damages or destroys the tumor cell. So this chemotherapy we usually use in several settings, like neoadjuvant chemotherapy. In neoadjuvant chemotherapy, we usually use before the definitive therapy, that is surgery. If the tumor size is very large, or the tumor size, along with tumor, there is several axillary nodes or locally advanced breast cancer, or the patient has been planned for breast conservation therapy, but the tumor size is very large. In those cases, we usually use chemotherapy first, followed by surgery. So this is called as neoadjuvant chemotherapy. Adjuvant chemotherapy is after completion of definitive therapy, that is surgery. So the role of adjuvant chemotherapy is to kill the micrometastasis in the blood. And then the next, palliative chemotherapy. Palliative chemotherapy is when the patient presents with in very advanced stage, that is stage 4 disease or widespread metastatic disease. In those cases, though the cancer is not curable, but by giving chemotherapy, it palliates the symptoms of the patient as well as prolongs the survival. So these are about chemotherapies. Now coming to the hormonal therapies. Hormonal therapy we usually use in hormone receptor positive patients. That means after surgery we do a immunohistochemistry on the histopathology sample like ER/PR, HER2/neu and Ki67. If the patient will be ER/PR positive, that means hormone receptor positive, after completion of chemotherapy we use hormone therapy for almost 5 to 10 years. And if it will be HER2/neu positive, that is considered as a poor prognostic factor, in those cases an anti-HER2 therapy is there, that is called as trastuzumab, and this trastuzumab should be used along with chemotherapy, and it should be continued up to 1 year. So these hormonal therapy are of two types, and that is selective estrogen receptor modifier like tamoxifen or aloxifene, and aromatase inhibitors like letrozole, anastrozole, exemestane. So in premenopausal patients, because their ovarian function is active, tamoxifen is usually preferred. Whereas in postmenopausal patients, because most of their estrogen comes from the peripheral conversion in fat tissues, so aromatase inhibitor is used in postmenopausal patients, and these aromatase inhibitors are letrozole, anastrozole and exemestane. Now coming to the targeted therapy. Among the targeted therapy we use in breast cancer, and trastuzumab is the only targeted therapy, that is anti-HER2/neu monoclonal antibody, and it is used in HER2/neu positive breast cancer after surgery for almost 1 year, those who are HER2/neu positive. And in metastatic setting we have several options like trastuzumab, adotrastuzumab, pertuzumab, and one of the oral TKI, that is lapatinib. These four are anti-HER2 therapy, can be used in metastatic setting. Along with several other targeted therapies has been approved like CDK4/6 inhibitor like palbociclib, ribociclib and abemaciclib. These can be used in hormone receptor metastatic breast cancer patient in first line as well as subsequent lines. Another recently modality of therapy has been used in advanced breast cancer is immunotherapy. Not only in breast cancer, several other advanced cancer, this immunotherapy has been approved recently. This immunotherapy, they use our own body's immune system to kill or destroy the tumor cell. And these immune cells like T cell, B cells, these are the immune cells which are usually they are in suppressed stage by the tumor and immune cell interaction. But by giving immunotherapy, they activate our own immune system and thereby kills the tumor cell. And these are like nivolumab, pembrolizumab, durvalumab has been approved recently in advanced malignancies. Now coming to the side effects or toxicities due to this cancer chemotherapy. Cancer cells are usually rapidly dividing cells, and most of the anti-cancer therapy, they kills these rapidly dividing cells. So and this chemotherapy, though they kills cancer cells, they also kill some normal rapidly dividing cells in our body, like blood forming cells in the bone marrow, then epithelial cells in GI tract, lungs, as well as buccal mucosa, so thereby causing mucositis and loose motion or diarrhea. And also they affect the skins as well as sexual organs. So these are the side effects by cytotoxic chemotherapy, which kills rapidly dividing cells in our body. And some of the common side effects seen in breast cancer patients during chemotherapy are fatigue, pain, nausea and vomiting, skin pigmentation, alopecia or hair loss, diarrhea, mucositis, constipation, then peripheral neuropathy, and that is due to nerve toxicities, edema or fluid retention, then sometimes radiation recall like syndrome, then anemia, infection, febrile neutropenia. So these are the common side effects which usually seen during cancer chemotherapy in carcinoma breast. Fatigue is one of the commonest side effects or toxicity of chemotherapy in carcinoma breast, and it is very hard to describe how it feels, but most of the patients, they describe it as feeling tiredness at all the time, and this tiredness does not improve after taking sufficient rest, and some patients describe it as difficult to wake up from bed, feeling sleepiness and feeling tiredness. So these are the symptoms or signs of fatigue, and this fatigue can be improved by some moderate exercise, as well as to be active in some games, or patient can walk to decrease or prevent this type of fatigue, or sometimes holistic approaches like meditation, yoga, reiki can be used to improve these symptoms of fatigue. Then anemia is also common during cancer chemotherapy. Anemia is due to low hemoglobin, because this chemotherapy, as they kills rapidly dividing blood cells, the level of red blood cell hemoglobin decreases, thereby causing anemia. And these patients, they feel tiredness, weakness, sometimes easy fatigability, as well as breathlessness. And these patients anemia can be improved by taking iron-rich foods like spinach, then peanuts, then lentils, cereals, eggs. So these are iron-rich foods. This can be improved by taking this anemia can be improved by taking such type of foods also. Infections are also common during chemotherapy in breast cancer patients, because our immune function does not function properly during chemotherapy. So chance of infection is very common, and as our immune function is suppressed, these opportunistic infections like bacteria, fungus, virus, they enter inside our body and they causes infections. So what are the signs and symptoms of these infections? Like fever, chills, rigor, then burning micturations, sore throat, nasal discharge, cough with expectorations, or redness, worm or pus discharge from the surgical wound site. So these are the common signs of infections, and it is very important to avoid or prevent these infections. So what are the precautions should be taken during chemotherapy to prevent infections? These are: try to avoid crowded places, especially during flu and cold seasons, and always try to eat freshly cooked foods, and try to wash with warm water all the fruits and vegetables before eating. Hand washing is very common, especially after hand shaking or before taking meals. Taking daily showers, that to keep your body clean, and then the dishes should be washed properly with warm water, and always keep your surrounding clean. Then take freshly prepared meals. So these are the steps should be taken to prevent infections. Anxiety is a common side effect seen during chemotherapy in breast cancer patients. This anxiety is a type of fearness or uneasiness feeling during taking chemotherapy. So most of the patients, they become anxious before taking chemotherapy, and this mild anxiety is common, and usually it goes after completion of chemotherapy. But those patients with severe anxiety, they should should have well balanced diet. They should have adequate sleep, adequate exercise, and they should avoid alcohol as well as tobacco. And now lymphedema is also a common side effect, especially after surgery, in complete surgery like modified radical mastectomy. In these cases, the lymph nodes and lymphatics, and they usually damaged by the surgery. So the lymphatics fluid, they build up and swelling occurs, especially in arms and forearms. These are called lymphedema, and the lymphedema can occur in months or after years after breast cancer therapy. So this is a common symptom. So patients should have physiotherapy. They can start physiotherapy after as early as possible after surgery, and now several other physiotherapy methods available with some lymph press machines. They can be used, especially those patients having lymphedema. Nausea and vomiting are very common with chemotherapy during breast cancer therapy. Nausea is a sick feeling in stomach and which feels like to have a vomit. Mild nausea also causes loss of appetite, whereas moderate to severe nausea, they causes vomiting. So these nausea, vomiting are very common with most of the chemotherapies like anthracyclines, taxanes, 5-FUs, targeted therapy as well as radiation therapy, and sometimes hormonal therapy. In this vomiting, nausea and vomiting also occurs. So how to avoid or prevent this nausea and vomiting? Several lifestyle modification factor can be used, like try to eat small amount of foods, or and try to eat dry fruits like cereals, toasts or crackers, and always rinse your mouth before and after taking meals. Always use ginger based foods because they causes less nausea and vomiting sensation, and always try to sit up after taking meals because lying down disrupts digestion, so increases chance of vomiting. So these are the lifestyle modification factor you can use, and always ask your doctor to have proper anti-emetics like 5-HT3 antagonist or some anti-anxiety medications that can prevent nausea and vomiting. Next is neuropathy. Neuropathy means damage to nerves. So some of the drugs, they are used in breast cancer treatments like taxanes, paclitaxel and docetaxel. They causes damage to peripheral nerves, and they cause peripheral neuropathy. What are the signs and symptoms? They causes tingling sensation, numbness, burning sensation, pain, loss of sensation, and sometimes sharp or shooting like sensation, and sometimes imbalance can occur with this peripheral neuropathy. And to prevent this peripheral neuropathy, we can have some physiotherapy methods or some relaxation techniques or some neuroleptics can be used to take relief, to have relief from these neuropathies. Pain is a common side effects during chemotherapy in breast cancer. This pain is due to damage or inflammation to tissues as well as nerves. So these pains are of three types: persistent pains, that means continuous pain; then breakthrough pains, that means sudden worsening of pain for a brief period of time; and acute onset pain, that means sudden onset intense pain. So these are the three different types of pains seen in breast cancer patients. And what are the causes? Whether it is chemotherapy, radiotherapy or surgery, all of them can cause pain in breast cancer patients. So how to manage this pain? If you are having severe pain, try to consult your doctor and evaluate the cause of pain. Try to take the adequate medications prescribed by the physician, and don't let your pain to be affect the treatment, and don't stop the treatment for pain only. And for breakthrough pain, you can change your body position so that it can reduce your breakthrough pains, and try to take the pain medications whenever you feel and consult your physician. Breast cancer can be curable if diagnosed early and treated properly. So if we can diagnose this disease in the early stage, we can cure more number of cases. So early diagnosis is the key for better long-term outcome in this malignancy. Thank you.